Hi, my name is John Pilcher. I'm a bariatric surgeon in San Antonio, and it's super common for my patients to come back after surgery in routine conversation and say, you know, I just make sure I have a protein drink before I leave the house in the morning because I don't want to get hungry at work. And I understand this. We'll talk about that, but there are three problems with this approach that we're also going to circle back to, and why there's probably a better way, and why it's going to be useful to allow hunger to happen. So first of all, I think it's normal to be afraid of the idea of hunger because people who I'm talking to after surgery, they've had the life experience before surgery of having hunger that was intrusive or aggressive or a hangry hunger that wasn't actually healthy. It was beyond healthy, above healthy. It was a representation of their energy hormones being out of balance, and they had hunger that didn't always make sense and could be a dominating fact of life when it arose. And so they did have to have habits of preemptively eating so that hunger didn't mess up what they were trying to do. The good news is that surgery should change that dynamic. It should flip the story so that hunger should be, with the help of gastric bypass or gastric sleeve, hunger should be something that is more reasonable or tame or helpful. In fact, hunger after a gastric bypass or a sleeve is often just a signal that the body is ready for some energy or ready for some food without being intrusive or dominant in one's thoughts. And that really actually does happen quite often. In fact, this sort of more gentle or tame hunger can lead food to seem like something that's appealing. I think it can accent or increase the enjoyability of food. So I like people to not fear hunger and to let hunger come. So what's the problem? What are the three problems with eating preemptively? First of all, eating preemptively means that when you don't let hunger happen, you don't know that you need to eat because your body's ready for nutrition, and then you don't know when to stop eating because you didn't have hunger at the beginning, so you can't use satisfaction as a signal to stop. You have to use fullness as a signal to stop. And so you're losing the opportunity to learn this really important lifetime habit of letting hunger be your guide for eating, number one. Number two, taking in preemptive food is just calories that you didn't need. And then number three, preemptive eating is also kind of eating on a schedule, eating more frequently, and as time passes, we learn more and more about this very beneficial habit of intermittent fasting or intentional fasting. In other words, the longer you go between giving your body fuel, the more, in a beneficial way, your body is going to draw on your energy stores, and it needs these extended gaps of 10 to 16 to maybe 24 hours without eating in order to actually draw down the fat stores. So I hope you'll give this a try, and I hope you'll find that it's actually not scary to be hungry. And for a little more information, you can search the resource section on our website, where Heidi, our dietitian, has done a fantastic blog about intentional fasting, also called intermittent fasting. Now, if you happen to be a person who is, after bariatric surgery, having cravings or the intense aggressive hunger, hangriness, then you're probably suffering from what I call cravings, which is a non-healthy hunger. And that's a situation where I definitely recommend you have a sit down with your bariatric team, because something metabolically is probably out of balance in your case. It may be appropriate to adjust your food plan. It may be that you have a vitamin deficiency, or it may be that we want to plug in some meds to help your bariatric surgery work better. Either way, this condition of having intense, invasive, intrusive hunger is not the expected natural state, and we should be able to help you. Good luck in your journey.